It's an often invisible part of poverty in America, the high cost of diapers. Even though more than 5 million babies and toddlers across the country live in low-income families, most government programs don't provide diapers or funding to buy them. Correspondent Ali Rogan looks at how some families are coping and how some organizations are stepping in to help.
It's drop-off time at Jubilee Jumpstart, a child care center for lower-income families in downtown Washington, D.C.
Morning.
Hey.
Kia Ross, who works at a different D.C. school, has a busy day ahead. So does her one-year-old son, Azai. Doing his daily reading, getting his steps in, and climbing the corporate ladder. But no matter what Azai gets into or on top of, he'll be clean and healthy, thanks to a precious, increasingly expensive item provided here for free: diapers.
How much peace of mind does it give you when you know that Azai has the diapers he needs when he comes here?
It brings a lot. 2 boxes of diapers go for like $100. So it does help me because it keeps my financials stability stable.
Jubilee Jumpstart provides 50 diapers for each child per month and more by request. Single mom Kia keeps most of Azai's diapers in his classroom.
I know that I can ask or suggest to Jubilee, like, hey, this month might be a little bit short. Do you think you can lend me some diapers? And they, they'd be like, oh, we have a bunch. Here you go.
Waving goodbye.
Unchanged diapers can lead to health problems for babies, like diaper rash and urinary tract infections. And beyond the child's health, studies have linked diaper need with maternal depression. Dee Parker Wright is the executive director of Jubilee Jumpstart.
We consider early childhood early parenthood. It happens at the same time. So when we are able to alleviate that stress for a parent, we enhance what's happening for a baby with their parent.
Jubilee Jumpstart is one of 75 organizations that gets their diapers from the Greater DC Diaper Bank. They're on track to deliver 10 million diapers by the end of the year, 5 times as many as before the pandemic. The head of the diaper bank, Rebecca Colloway, says they still use their pandemic emergency model, giving larger quantities of diapers to regional distribution hubs.
The need continues to persist. The pandemic just made it easier to ask for help. It became less taboo because everybody needed help.
The bank was founded in 2010 by a new mother who was struggling despite having everything her baby needed. She asked different charities what parents requested the most. The answer then, as it is now, diapers. It now serves more than 30,000 families a year in D.C., Northern Virginia, and Maryland. It buys some diapers wholesale and accepts donations. The need remains high, partly because most government assistance programs don't cover diapers. And with inflation, those costs are even higher. In the U.S., disposable diaper prices are up 10% since last year, and they're currently subject to sales tax in 29 states.
The average infant goes through 8 to 12 diapers a day. That's over 200 a month, several thousand per year.
You can't put food stamps towards diapers. You can't put Medicaid towards diapers.
Catherine Edwards is an economist at the RAND Corporation, a global policy institute.
Sadly enough, the U.S. has no peer in how little it invests in children and young families.
In a 2020 study, UNICEF ranked 38 developed countries by child well-being. The United States was 36th. Some of the contributing factors include poor parental leave policies, a lack of public investment in childcare and early learning, and scarcity of affordable housing compared to other advanced countries.
There's no substituting away from diapers, right? There's no, trimming fat from the budget. We have okay, well, maybe we won't get diapers this week.
So some parents, like Brittany Nolasco from Colorado, are getting creative. Just before the pandemic, Nolasco was on maternity leave with her baby daughter, only receiving half her salary. During COVID, her husband lost his job.
We were on a one-income household and weren't really unsure how to pay for our diapers.
She started couponing and using rebate apps, and she started sharing her tips on the social media app TikTok.
These are the costs of diapers I have seen grow.
It went from just kind of a couple thousand views to a couple 100,000 views. And I had local moms reaching out to me who have known me but didn't know I was a couponer saying, this is amazing. Thank you so much. To moms who really were not able to even really pay their bills or buy generic diapers for their little ones.
The diaper industry has two big players, Kimberly-Clark and Procter & Gamble. They control more than 2/3 of the U.S. market. As inflation increases, Nolasco says she's seen brands raise prices and cut coupon values and rebates. Neither Kimberly-Clark nor Procter & Gamble responded to repeated requests for comment.
I think it's hard, and I think it's sad that we live in such a world where just having to decide whether you can buy diapers or pay your bills is a choice.
Catherine Edwards says the world wasn't always like this for parents.
It is a modern phenomenon of the past really 20 years that the squeeze on young families has been so hard that the need for, basically charity diapers has not only, been called into existence, but it's actually a thriving network of charities to get millions of diapers to families every year.
A network that Rebecca Calloway wishes didn't exist at all.
I would love for us to be able to work ourselves out of a job. Simply providing diapers isn't going to work us out of a job.
For now, every little bit is helping parents like Kia Ross.
It takes a lot as a female to bring a child into this world, making sure that he have diapers at home, wipes, soap, supplies, just the basic needs. Everything goes to your child. Are you okay?
With a few basic needs like diapers taken care of, Kia can spend more time focusing on the priceless things, like time with Azai. For PBS News Weekend, I'm Allie Rogan in Washington.